Welcome to Distrust and Disparities, Dismantling Black Health Disparities podcast. We examine health disparities that disproportionately affect Black women and Black families. In addition, we amplify organizations and individuals working to dismantle racist health practices and systems to improve health outcomes for marginalized communities. I'm your host, Jasmine Moore, a registered nurse, and I'm joined by my good friend and co-host, Camille White.
It's very fascinating how emotional but also divinely connected birth work is. It's not just straightforward. It's not like you show up at a birth and you're there to hold space, you're offering comfort, you're offering reassurance, you're giving information, but you're also learning about cultures. You're learning about yourself. You're learning about tradition.
In this episode, we interview Emilie Rodriguez and Guramrit LeBron, two doulas creating a better standard of care in maternal health for families of color through their organizations, Ashe Birthing Services, and the Bridge Directory. And they discuss the importance of community and ancestral practices to provide the best support for birthing people.
Welcome back to another episode of Distrust and Disparities. We're glad you guys are tuning in for another episode. And recently, we have been discussing a lot of the backlash and consequences of banning abortions and also the maternal health crisis going on in the U.S. As we pointed out in our last episode, the dominant narrative being pushed is that this is only a Black maternal crisis, and it results in creating fear in Black birthing people, and it casts Black bodies as the problem. However, if we zoom out, we can see that maternal health outcomes across the United States, including for white populations, are atrocious when compared to similarly economically advantaged countries in which midwives are the leaders in providing maternal care and designing the systems of care. We really wanted to shift the focus from talking about the unfortunate deaths and the court cases to what solutions and progress is being made to tackle this issue. The underlying theme seems to be that we are not listening to Black women and Black birthing people. We are ignoring the history and the amazing contributions that doulas, midwives, and birth workers bring to the table. We're excited to have two special guests joining us for today's episode to share their experience and knowledge. So on today's episode, we are joined by Emilie Rodriguez and Guramrit LeBron, two experienced doulas working to address the unmet maternal health needs of birthing people. We're excited to have you share your story and to talk about the amazing work you are doing with Ashe Birthing Services and the Bridge Directory. Welcome, ladies.
Thank you so much. We're happy to be here.
Yes, happy to be here. Happy to meet you and connect.
Same. So we'll jump right into our questions. And one of the questions after reading your bio and just looking at your social media and all the amazing work that you guys are doing, we noticed that both of you started in different career fields before becoming doulas. Can you talk about what led you to becoming doulas? Was there an aha moment or experience that kind of brought you to this work?
I can go first. I really honestly did not think that this was going to be my life path. From childhood, I really thought I was going to work in magazines. I did that for a few years after graduating college, and something that just kept on showing up for me was maternal health, nutrition, maternal health, nutrition, child development. And so I was just kind of coasting in there, checking it out a bit, and kind of took a step back, ended up working at farmers markets for a couple of years and managing those. So, really focusing on disparity with food apartheids, and food desert. access to food using SNAP benefits at farmers markets, which is really amazing. And then there was just this one moment as I was exploring fertility and understanding my own body where I decided to take a doula training. It was so basic. It was so basic, but something about it just felt like I was in the right place. And maybe a year after I had taken that initial training is when I ended up in a mentorship program, which led me to Emilie, actually, and our conversations together. And just, I think that really was that aha moment. Just once we met each other and started to really get into this work and understand that this is where we were supposed to be. And then everything kind of blossomed after that. And I just feel like we continue to give birth to even better versions of ourselves through this work. It's been wonderful.
Yeah. I was just having this conversation with a friend because nobody says like, hey, do you want to be a doula when you grow up? Do you want to be a birth worker? Like these are terms that I had never even heard of. But now looking back, in my late 30s, I'm like, I wasn't ready for it either. So, so my background is in veterinary medicine and medical anthropology. And so the veterinary medicine part was because I loved biomedicine. Like I wanted to be a vet since I was a kid. I really loved animals and healing things. And, I think about like my 5-year-old self, like building bird houses or like bird nests. Like I would go in the yard and collect twigs and sticks and things and build mud and build a nest and like tell the birds that it's ready. And I was like thinking that I was helping them, which is so on brand for me now at 37. I'm like, yep, building bird nests just for different types of folks. And so I became a veterinary technician as a result. And I did that throughout college until I found anthropology and then medical anthropology within that. So like the study of medicine and cultures. And I specialized in birth in the United States, and that was my introduction to this world. But I really didn't get called to be a doula until my own birth experience. I feel like it was the first time that I connected to my ancestors and really understood the ceremony and the transformation that happens as a result of birth and how disconnected we are to our power as people. And that's what really inspired me to become a doula.
And I think that's amazing. Just for our listeners, you may be doing certain things, but you may feel called to want to address like a different, say, health disparity or move in a different direction. So it's never too late. And since you mentioned it, I want to jump right into it. Can you talk more about the importance of incorporating ancestral traditions into your practice as doulas?
Yeah, I think honestly, I feel like birth work really helped bring that to the forefront where there's this curiosity that kind of comes with it, like for my own self, but also for clients asking, hey, so is there something that is important to you during birth, during postpartum, and recognizing how sacred and special that is. It it's very fascinating how emotional but also divinely connected birth work is. It's not just straightforward. It's not like you show up at a birth and you're there to hold space, you're offering comfort, you're offering reassurance, you're giving information, but you're also learning about cultures. You're learning about yourself. You're learning about tradition. And it's become just part of us. And I have been able to really discover more about my Indian heritage from working with different clients, but also as Emilie doulaed me when I had both of my children, and, her being present for the births of my babies, it allowed me to really just like reconnect to my roots and just recognizing how important that is for all of us, where we're so disconnected because we have to put on all of these masks and be palatable for other people, whether it's as a human being or rather in the role of parent. Um, just, I have to do all of these things. I need to recover quickly. I need to jump in and be superhuman. But recognizing this like sacred 40 to 42 days of rest and being loved on and calling in community and calling in your village and your support system. It's really become how we live and breathe,
Yeah, I think just echoing what Guramrit said, I think a lot of times we feel like overwhelmed with the idea of tapping into our ancestral power. Like, what does that even mean? And it sounds complex, but really, I think the most way that we tap in is through food. Like, that I just get so much joy, like cooking. G is a chef, she has her own cookbook. There's so much wisdom that we have in our traditions of the things that we cook, and we tap into our ancestors in that way. Like, it doesn't have to be an altar. It doesn't have to be like, I feel like the most connected thing that I do is cooking and breathing, like, and so with birth, we're in this really thin line between life and death, and we're supposed to be the tree in that. Like, we're the roots, we're grounded. And in order to be grounded and the anchor in that birth, we have to be tapped into something too, whether we know it or not. And and so I think that when you are connected to your, like, when you know where you come from, you can stand on those shoulders in a more clearer, more grounded way.
Yes, both of you ladies bring up great points. And I was just thinking just about community and just with ancestral importance. When you give birth at the hospital, typically there's like a limit of just like two people. But being able to have like a community around you, doulas, midwives, and just like your family, like present, like that makes like a big importance. And I would say that's one of the things that's like lacking with, say, a traditional like hospital birth. It's become more like sterilized, and sometimes pregnancy is looked at as like a sickness in some cases versus being empowering and transformative. That was just one of the thoughts that came to me as you guys were talking about the importance of incorporating like ancestral traditions.
Yeah, and I think that that goes to like, how was gynecology and obstetrics created? It was created in slavery, with non-consensual, non-anesthetized uh, Black women. So when we know that, I think what's crazy is most people in medicine do not know that, even in this field. And so when we know where this field has come from, we can understand more how we got to where we are now today. So, and then tapping into our ancestors, I think that that just comes as we tap into ourselves, and as we, because like you can, yes, the hospital environment is really sterile and disconnected, but people are really reclaiming that and what that could look like. And one of those things is hiring a doula. Like, we wish we didn't work in a capitalist system where people had to hire us. Like, it should be included. This is a birthright, you to have support if you want it. Um, so I think the ways that people are tapping in is getting birth support. The 40 days that Guramrit was saying, like, not using ice packs. Like, there's there's such interesting things that I feel like when white people take our wisdom, it's like the game of telephone. Like the actual wisdom gets lost. Like when I see ice packs going on, vulvas after birth, like I'm like, ah. Or when I see like the sitz baths that are plastic, like that you're supposed to like pour hot water into, and then all those carcinogens, like go upward. It's like we lost the medicine in biomedicine, sometimes. But then at the same time, I feel like because they denounce what we know, and we were talking about this a little bit before, is like they sometimes denounce what we know, but they do know, because then when you look at antibiotics, there's echinacea in all of them. Like a lot of our medicine came from plants in biomedicine. A lot of our wisdom has come from our inner knowings and our traditions, our food as medicine. So, I feel like it's just really about us reconnecting to ourselves to get back to the center.
Yes, I totally agree. And I've said this several times. I believe the solution to what they're calling the maternal health crisis is going to be a partnership between doctors, nurses, as well as doulas, midwives, and other birthing support persons, just working together to improve the outcomes. Because, like you said, if you look at history, how gynecology came about, and just basically saying like doulas and granny midwives that they're wrong and this and that, and not listening and seeing what they're doing, and just kind of white men like forcing themselves into gynecology. But if we work together, that would help to improve for everyone. And I have a question based off like your experience as doulas. Do you think when you first started versus now, do you think hospitals are more welcoming to having doulas present at the birth compared to, say, years ago?
I think it has changed. I think we're really hopeful about the change, because, we started working and building Ashe birthing services, which is now a team of 15 Black and brown doulas based in the Bronx, into the Bridge Directory, which is a platform to connect families to providers of color, because we know that our providers, that our outcomes are better when we're seen by providers that look like us and that understand us. But those same providers are trained within the same white institutions. So we're going into institutions and retraining them on an anti-racist patient empowerment approach. And that's really what our work is centered with now. We're not really doulaing so much anymore, except, when our close family or friends get pregnant. Please, nobody else get pregnant this year. Like, we need a break. But so I think that it has changed, especially the fact that we're operating on a federal level, right? Like, we just got an NIH grant a year ago. It's a 7-year grant where we're focused on racism in the biggest institutions. Like, we couldn't even say that word a couple years ago. It had to be implicit biases. It had to be social determinants of health, where all those issues are rooted in racism. So I think in order for us to be able to make change, we have to be able to identify the problem and say it out loud without everybody being like, but not me, like, no, it is you. It's you, it's me, it's the institution, it's the system. And because we can't burn it down, we have to figure out how to operate within it. But I think we are absolutely healing those disparities. And a big part of that is our work at Bridge.
And just to segue off of that, can you talk about what led you to forming Ashe Birthing Services as well as the Bridge Directory? Can you talk us about the path to forming these two organizations?
Yeah, so Ashe was started, but with me and a friend who's also a professor at City College, my alma mater, Dr. Griselda Rodriguez. Solomon, sorry, she got married. Dr. Rodriguez Solomon. And we formed Ashe almost 10 years ago. And, after about a year, she said she wanted to focus on Brujas of Brooklyn with her twin sister. And so she phased out and is still really close to us. And then that's where I started building with myself first, and then slowly adding people. And when Guramrit and I met, it was through Manhattan Birth, and we realized we actually lived 10 minutes apart from each other in the Bronx. And so she came over for tea, and we've been work wives ever since. So I think that when I look at Ashe and its transformation, it has transformed with every iteration, but it has never been excellent until Guramrit got on board.
Truly, she flatters me, but it's definitely the work lives thing, but also we continue to amplify our dreams together. And we're like, oh, that's a great idea. Let's try this. Let's add in some new folks. Oh, how about this training? Oh, how about we try this? What about, we're just finding new ways to make ourselves better. And that's really, really sisterhood at its finest. And I remember, it's been almost 6 years of us being together, but I definitely remember early on hearing her talk about the bridge. And I'm like, yeah, I don't know what you're talking about. And she's like, oh yeah. So she'll tell you a little more about the story, but I jumped in because I like to take things and I like to make things pretty. I like to make it easier for folks to find things. I want someone to look at whatever we've created and feel like this is for them, that it's easy, that it's accessible, that it makes sense, because we've created, initially it was just a free resource with Black and Brown and Indigenous people of color providers and professionals who serve the perinatal period and beyond. But now it's not just a listing, it's a platform. It's a place where folks can receive education, where they can receive trainings, where they can also be in community, whether you are the provider or you are a person who is pregnant or newly postpartum or just exploring parenthood. And it's back to those different iterations. We've given birth to so many different versions of the bridge, but right now I feel like we're on the precipice of just really this huge turning point in what the bridge is supposed to be, which is to create a brand new standard of maternal health. And that's exactly what we're doing. So it's beautiful. I'm very proud of what we created. I want someone to look at it and be like, oh wow, yeah, that's where I found my doula. That's where I found my mental health therapist. That's where I found my midwife. And I know that these are good people because Emilie and Guramrit have vetted every single person that is on this site. They know them. They're in community with them. It's not just some stranger in these streets acting like they're making shifts. No, they're adhering to this model that we've created, these standards that we are setting.
Yeah, and I think that there's a way to incorporate us within these businesses too. We have found the way to do that at Ashe successfully. People are always like, are you an agency? Are you a collective? We're like, no, we're neither, we're really trying to do something different there, and in the bridge, we're led by our council of elders. I don't know another organization that has a council of elders, but we thought what happens if we're trying to solve maternal health over here and other people are trying to solve this different problem? What happens if we just get people together and say, okay, let me sit at your feet. What direction do you think we should take this year to make change? What wisdom can you offer us so that we can do something different than what's been done? What happens? I had a birth the other day. I was texting the surgeon, while she was taking care of our client, unheard of. And it's because of the relationships that we're making when we're tearing down these walls. That's why we're calling it the bridge, is because we're really trying to get in communication and in community with the people, all perinatal professionals. And so to be able to text the surgeon and figure out what's going on when I'm not there, it was just so, it was it was so dope, you know?
Yeah, I think that's amazing. Just the community, the wraparound, like you're being able to text the surgeon and letting them know what is going on, and just so you can get the best outcomes for the mom that's giving birth. That's what's needed. Like the mom and the baby, like putting their needs first is amazing. And I'll say with the Bridge Network, you mentioned it's more than just OBGYNs. You're talking about pediatricians, mental health. It's kind of like this wraparound service. Can you talk about like the importance? Because sometimes we get so like one track mind, like, oh, we want to help the mom have the baby. But what about once the baby comes? Like, what if they're going through, financial struggles, maybe like struggling with mental health? Can you just touch on like the importance, even like nutrition, what to eat, what to feed yourself? Those things are very important. And sometimes we don't talk about those things.
One of the things that was really important is for us to have a warm handoff. We didn't just want folks to find one person that would support them. We wanted them to find their village. We want them to find their community. And this is the place to do it. Like, oh, I've worked really well with so-and-so. This therapist is lovely. And let's create a plan. And any of the providers who are, let's say, one of the professionals, one of the doulas on the site says, hey, let's talk about your postpartum plan. What is that going to look like? Here are some recommendations. You could read more about them on the Bridge. I cannot tell you how many people we have heard like, oh yeah, I totally found my therapist on the Bridge. And I'm like, yes, that is amazing. And they take your insurance. Great. And they do a sliding scale. Awesome. Oh, and they have a support group that's free. I love it for you. More things like that. That warm handoff, that continuity of care with someone else that we trust. So it builds that referral list without the actual doula having to do another referral list. It keeps it unique. It keeps it small. It keeps it very curated. I definitely love that about what we've created.
Was there anything else you wanted to talk about as far as Ashe Birthing Services or the Bridge Network?
I would say Ashe Birthing Services is a team of 15 Black and Brown doulas based in the Bronx. We serve about 400 families a year in New York City and the surrounding areas. And soon we're going to be launching a virtual bite-sized childbirth education program that we're really excited about. We're working with insurance companies to get them they're starting to cover doula services and childbirth education. And so we're seeing a lot of those changes, and we're really excited to make this more accessible to people. And then for the Bridge directory is based in the Bronx also. We serve New York City, and we're expanding to New York State this quarter, and then to Baltimore DMV area next, which we're really excited about. And so we're a platform to find Black and Brown providers. As Guramrit said, you can look with your, like the service, the style of provider. So if you're looking for like a more traditional care provider or a more biomedical provider, you can search like that. Also the location, what languages. We are people that speak over 600 languages. You need to be able to find an obstetrician that speaks Wolof in your area. Like, they exist. So how do we find those providers? The Bridge. And then we're going into different companies and institutions and training them on our model of care. And one of the big tenets of our model of care is accountability. In maternal health and medicine, there is no accountability. If we have a maternal death, it takes 3 years in New York City to figure out what happened, to have a review. And so there's such a delay there. There's no accountability as far as like when ACOG comes out with guidelines for the doctors to actually follow them. So we're really proud and excited to offer our model of care, and hope that it will change the maternal health landscape.
I think that's wonderful. And I'm glad you guys are expanding to, other states, outside of New York City, to the whole state, and also just like the DMV. This is exciting because, this is working, and it's like we need more people on board and more people, taking what you're doing and implementing it.
Have you checked out our website? There you can find all of our episodes and show notes. You can even listen directly on the site and catch up on any previous episode you may have missed. You can read our bios and see what we're up to. Also, we made it even easier to contact us. Just fill out the form on our homepage and click submit. We invite you to recommend guests and topics we should feature. So what are you waiting for? Go check us out at distrustanddisparities.com. Okay, so for this second part of the interview, we really wanted to discuss, like, how do you set yourself up for success in birth, pre and postnatal, especially since both Jasmine and I aren't mothers. And like we mentioned in the intro, a lot of the focus has been on maternal deaths, and that has created a lot of fear around pregnancy for our communities. And in our discussions earlier of you talking about, birth is sacred and is transformative. So when in your pregnancy journey should someone start looking for a doula?
I love this question so much. I think we really have folks that like to wait until they're pregnant, but you can have a doula in the beginning. You can have a preconception fertility doula who can kind of guide you through this process, which I think is so amazing and so necessary, because we do all of this in silos, right? I think Emilie and I talk about this all the time, because the fertility journey and even preconception journey is so isolating and so lonely. And it's a great place to find out, great time to find out like what your desires are, what your hopes are, what your plans are, and really prepare yourself for success once you are able to be pregnant. And that can lead you to finding an amazing doula. Sometimes we have doula people call us the moment they pee on a stick, or the moment they get a blood test back that says that they're pregnant. And honestly, those are really my favorite people to work with, because, you're building the relationship from the beginning and building that trust from the beginning, so that every possible change and like discomfort or question or anything that pops up for you during pregnancy, or especially early pregnancy, which I find is so lonely, and there's so many things happening and it's so exhausting. It's great to have that resource, that guide, that friend, that person who knows this stuff, so that you can like help navigate it. But then you have folks who are 38 weeks, and that's totally okay, who want to hire a doula, and we love those folks too. I'm a very type A person. I like to have a lot of structure. I like to have everything planned from day one. I think I knew who my doula was on day one, but of course, Emilie knew that I was pregnant, like right in the beginning, knew I was trying to get pregnant. She knew like the hour after I found that I was pregnant for both kids. So we build that already. We're sisters as it is, but we are even closer now that we have this bond of her seeing me in my most vulnerable state of pushing my children out of my body.
Yeah, it's such an honor to attend your circle's births, and to be, especially as folks of color, like to be naked, spiritually, emotionally, physically. So I'm really honored, Guramrit, to have attended and been your doula. How I would set up for success is, one, I would say to relearn your body and what it actually means to be pregnant or to get pregnant, because we're really starting at like -10. Like if you grew up in the United States and you had sex education, it was trash. Like it was, be abstinent or die. Like that was the message. And so to reclaim, like, I think it's a really big shift trying to get pregnant. And so I would say 3 to 6 months before you're trying to conceive, really start getting healthy. And healthy is such a subjective term, but what I mean by that is like get on a prenatal, Eat foods with like great vitamins and folate and all the things that you need to create healthy human in your belly, and just kind of get on that path. I also want to say with the education piece is I think growing up I thought that you could get pregnant anytime, and it wasn't until I was in this field that I was like, oh, wait, if you're trying to get pregnant, then you want to have sex not every day all the time like you would think. It's every other day, one time, for your period of ovulation, right? Because you want to build up the sperm levels. This is cis hetero, sex I'm talking about, but generally. So if you want your partner to build up the sperm, and also for you to orgasm as well, because you have to take that sperm to the right spots, right? Like, because I think we're just not even talking about like how it works, like, and how like when you can, yes, and the egg decides, absolutely. So like this is where decolonizing these frameworks really comes in, because again, we've been told like there's this powerful sperm, it's the fastest sperm, it's the strongest sperm, and it goes through this crazy journey and it beats all the other million sperms until it gets to your egg. No, 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 my friend. The egg decides which sperm to take in. And it just shows like where patriarchy comes in on every facet of our world, because even in the way that we talk about strength and the way that we talk about choice goes to the man's sperm, or the person's sperm, and not to the egg where the real power resides. And that is a metaphor for birth in its totality. So I would say that that's the preconception and conception journey. And then how to set yourself up for success in birth is to assemble a great birth team. So look on the bridge and find a provider that understands you, that is vetted, that you feel safe with, and so decide like, do I want an obstetrician or a midwife? Am I low risk? Like, let's get clear about things. Where do I want to birth? Do I want to birth in a hospital, in a birth center? Do I want to birth at home? Do I want a doula? What expectations do I expect from my partner? Like, if you have a partner that is really timid or can't, handle you in uncomfortable spaces, or can't handle blood, then like I wouldn't think that in labor it would be different, so find the support that you need. I think a lot of times people think about who they want to be there with to celebrate the baby. They're like, I want my mom, I want my partner's mom, I want my sister, I want all these people. And it's like, everybody can be there at the top of the mountain to celebrate with you, but who do you need to get you there? And that's your birth.
Wow, you guys dropped some amazing gems. And I like that metaphor, like who do you want there with you to support you through that process? Who's going to advocate for you, for your needs, and to know what you want? Like, that is like very important. And also just the education piece, like you said, sex education is non-existent, and just having these open conversations, because a lot of these things are so hush hush, like we need to be talking about these things now and sharing this information now.
Yeah, including miscarriage. I think there's so much stigma around miscarriage, but we all have miscarriages, and 1 in 5 pregnancies end in miscarriage. So we also have to really get used to talking about that as well, because that's something that we all experience, and yet we're not discussing it amongst each other. It's only the positive pregnancy test that ends in a baby,
Yes, that's very, very true. Just releasing the shame and just recognizing that this is something that all women go through. And, you don't have to go through it alone. It doesn't have to be hush hush. So creating that community, creating that support system is very needed. And Also, we wanted to ask, you mentioned there are different types of doulas. If you can talk about some of the different types of doulas and also some of the services that doulas provide.
Yeah, so there are fertility doulas who can help you during like preconception or any kind of like special circumstances, whether it's trying to get pregnant, whether there are challenges with getting pregnant and they need some reproductive assistance. Um, it, Also, there are abortion doulas support, for that thoughtful process, offering care, which is very, very postpartum. So there's the birth, there's the abortion, there's fertility, there's a birth doula who really holds the hand from throughout pregnancy and during labor and early postpartum, and then the postpartum doula who's really there to nurture the parent and the new family as they adjust into their new role. And there's also, death doulas who can help with the life transition. So really, birth keepers and birth workers, they're so focused on this vulnerable, sacred, special time. And I think we've spoken about this before, where it used to be our sisters, it used to be our neighbors, it used to be our aunts, uncles, whoever, anyone, someone to be in your space, someone you trust. And since I'm circling back to community and building our village, like that's where the doula fits in. This is where the birth workers come in, just being those people who we're the village.
If you are enjoying this episode, you should consider buying us a coffee. Yes, a coffee. That small gesture will help us continue to create quality episodes and content. Click the Buy Me a Coffee link in the show notes or check out our website at distrustanddisparities.com. In your experience, have you gotten a lot of mothers and birthing people that come to you after they've had a not so great experience with a hospital birth? Do you typically sort of see that in your work?
We've seen that plenty of times. It's interesting because we'll see someone who will come and see us after, like, this is their second baby or their third baby. They didn't have a great experience. But even sometimes, like, we cannot, yes, we are at the front lines. Yes, we are there to advocate, but also educate, advocate, and empower. But there's only so much fighting in a system that we can do and healing that we can do within a system that is not built for us. So there is something that can happen in that moment. It can be unsavory. It can be something that's not a great experience. But what we end up doing is being present, being able to decipher that, being able to walk through that, being able to hold space for that. I don't know, Em, if you have something you want to add to it, just in those experiences.
Yeah, I think people definitely have bad experiences and trauma, but like Guramrit was alluding to, they have to choose a provider that is aligned with them. That's number one. I think the United States is putting a lot of onus on like doulas to save lives. We should not have that. We should not take on that role. That's not our job. The system is broken. And I think that requires that pregnant people and their families take more responsibility than they should have to find a provider that they're safe with and the policies of their hospital or birthing place that's aligned, right? We get requests sometimes where people are like, I do not want vaginal exams. I don't want an IV. I don't want to be monitored, but I'm going to this hospital. Like, and we're like, that's like asking for pizza at a Japanese restaurant. They don't do that. They don't do that. The hospitals in New York City, we'll speak on because we're here, they have epidural rates of 97%. They don't do unmedicated births. They have not seen that often, so if you're trying to look for an unmedicated experience, and you're low risk, you like get out of the hospital system. But I think when we try to fit those pieces in like a square and a rectangle and then wonder why it doesn't fit, I'm not saying that like trauma is inevitable, but you do need to know what you're walking into. And if that doesn't align, then you have the power to find something that it's just going to take more effort and it's going to be harder, but it's better than being on the other side having regrets.
And I know, Guramrit, you have your daughter, but if you had a moment just to ask this last question, and she can be on the mic, we just want to know what's the most rewarding part of being a doula?
This part right here. Just the additional wisdom, the yeah, I think I talked about it a little bit earlier, but just like that reconnection to our traditions, to our culture, and coming back to ourselves. It's like coming home again. And with each birth, which each postpartum experience is an unveiling. And there is something that we're always learning. I'm forever a learner. I will always sit at the feet of my teachers, and you realize how much you do not know. It is very humbling work, and yes, Freya agrees that it is just very important to allow ourselves to be humble here, and yeah, burst through ourselves, rebirth every time.
Yeah, and I would say for me, similarly, it's definitely a mirror, like into the things that I need to work on. We can't help people sit in fire and face the hardest thing that they've ever done if we're not willing to do that same work outside of the birth experience. So I think being a doula has really taught me to prioritize my own healing journey and my own self-care so that I could take care of other people. And I would also say, like, I think about this story that my brother used to tell me about a different context, but I apply it now. And it's the approach that we take with one birth at a time, one family at a time. It's the story about how two people were walking on a beach and came across like 1,000 starfish that had been pulled out of the water or like by a wave. And one person ran over and started, throwing the fish back into the ocean. And the other one was like, there's way too many here to help, like, what are you doing? And it's like, well, it matters to this one and it matters to this one. And so I think sometimes we can get caught up in the overwhelming responsibility. Like when people are like, what do you guys do? I'm like, oh, we're trying to heal racism in the medical industrial complex. Like that sounds insane. And yet that's our job right now. Is like, that's what we're doing in a nutshell, but it matters to this one and it matters to this one.
Yes, that is amazing. And we just have one last question. What is your wildest dream or goal for Ashe Birthing Services in the Bridge directory? Like if money and resources was not an issue, what would you do?
I mean, I was thinking about I think Emily and I would love for there to be a national standard that we develop where there's you look around and it says bridge verified and it means something. But also, I mean, if we're talking about money and we're talking about long-term dreams, I feel like we are integrated into our dreams. We're probably gonna, when we have our white hair, we're going to have some kind of farm to table like cafe or B&B, and it'll be for community. It'll be a sacred space. It'll be nourishing foods and a place for respite. So, it's healing is liberation. Liberation is healing. Yes.
Yeah, I think as true Tauruses, we're really good at a lot of things. And so figuring out what we want to focus on in that season is really important. But I think for Ashe, just I'm excited about the childbirth education series and the fact that it's like a virtual series, because then it can reach anyone in the world. And I'm really excited about the impact there. And I see us doing trainings and things like that in the Ashe space. And then for the bridge, like G said, like accreditation, creating this new standard of maternal health, I think is the direction we're going. And then as far as our cafe dreams, as home cooks, and she, she's a chef. Like, I think that I would like it to be like a place where people go for postpartum care, for traditional postpartum care. If money wasn't an object and we could just create like this beautiful home where you get herbal baths afterwards, and you have an abuelita in the kitchen cooking soups, and you have an herbalist making curated teas, and Guramrits in the kitchen, like making the traditional, I don't know what the traditional Indian thing is, but like whatever that is, like
Panjiri.
yes, like I just see us reconnecting to our roots and really getting to a place where, like, it's interesting because I think technology is moving in an interesting way, and then there's a group of people that are like, let's homestead. And I think we're in that group where we're like, yes, we have a technology company, in the bridge, and it's dope, but we want to use that to make like greater impact while still connecting to our ancestors and to our traditions.
I love that. And I hope it comes true. And, I want to be a part of it. I want to be man in the bookstore part and giving out books to people and, maybe making coffee. But I love that.
You are a part of it. Just being on this podcast and giving us the platform to talk about our dreams and our work, it really elevates what we're doing. And we're really thankful for you both.
And thank you so much for taking the time to come on our episode. We know you guys are very busy with your work and also raising families. So we really, really appreciate you guys making time to come on here to share your knowledge and expertise. Like, I'm so excited to Google and look more into all the things that you shared and things like that. And also, I'm like, I got to work on the video and stuff like that. I'm like, people need to see this. They need to see the wonderful words that you have provided to us today.
Thank you so much. And thank you for your work in medicine. And thank you for the work that you're doing now and with yourselves. And we look forward to talking to you guys more another time.
Thanks for listening to this week's episode. Do you have recommendations for topics we should discuss about health disparities or injustices? Guests we should interview doing amazing health justice work? Or organizations we should highlight creating positive change for marginalized communities? Please visit us at distrustanddisparities.com or email us at distrustanddisparities@gmail.com. Remember to subscribe, rate, and review us wherever you listen to podcasts. And follow us on Instagram, Facebook, Twitter, YouTube, and LinkedIn.